CAR T cells represent a practice-changing immunotherapy for patients with B-cell malignancies, but they also come with a unique spectrum of toxicities. For example, the cytokine release syndrome or hematotoxicity, which can predispose patients to severe infections. Importantly, these side effects can be profound and long-lasting due to the nature of CAR T cells as a living drug, and in a best-case scenario, CAR T cells persist within the patients. However, the precise impact of these toxicities on mortality after CAR T-cell treatment has been poorly described. So the goal of the study was firstly to characterize non-relapse mortality in patients with lymphoma and myeloma who got treatment with CAR T-cells, and secondly, to identify the causes of death that actually led to the non-relapse related deaths in these patients. To address this, we performed a systematic review and meta-analysis of all studies published until the end of March of 2024, and we screened over 3,500 studies, of which 46 were eligible for further analysis. In total, our analysis included over 7,600 patients, and the majority of these patients were patients with the subtype of large B-cell lymphoma and multiple myeloma. Using random effects models, we calculated non-relapse mortality point estimates. And what we saw was that 6.8% was the non-relapse mortality rate at a median follow-up time of 13.4 months in these patients. This value, of course, was a bit different in patients with indolent lymphoma and large B-cell lymphoma, where it was between 5 and 6%, and 8 to 10% in patients with mantle cell lymphoma and multiple myeloma. But we were also able to investigate the impact of other variables on non-relapse mortality. For example, the use of specific CAR T products, the number of previous treatment lines, or the treatment era before or after COVID-19. And here we saw that actually the use of specific CAR T products was significantly associated with higher or lower non-relapse mortality. For the second part of the study, we analyzed 574 death events across all of the studies. And what was very interesting to see was that over half of the non-relapse related deaths were due to infections. Also interestingly, the second most common cause of death were second malignancies. We believe that this study provides a comprehensive overview of non-relapse mortality in patients with lymphoma and myeloma, and that the findings of the study will inform both clinicians and patients with the associated risks of this treatment. The cause of death analysis further highlights the importance of infections and hematotoxicity and tells us as clinicians that we need to focus our attention on infection prevention and management in this specific patient population.